Okay, good evening. We're once again having our distance meeting of the Lee County Board of Commissioners. I'd like to call it to order this evening. At this time, we'll do a roll call for our commissioners on the phone. Commissioner Reeves,
Present.
Commissioner Del Palazzo,
Here.
Commissioner Dodson,
Here.
Commissioner Sharp,
Here.
Commissioner Connect,
Here.
and Commissioner Smith.
Here.
And myself. So we have everyone on the board present, either live or via phone. So at this time, I'd like to, we'll stand and just have a moment of silence and then the pledge. Thank you. Thank you. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. Since this is a special meeting, we have a little bit of a different protocol here with no public comments or really an agenda other than the two things that were advertised. We don't add items on a special meeting. So the first item of discussion is to consider a resolution regarding opening North Carolina. And I think Commissioner Smith has provided, were both of these yours? Both resolutions?
Well, the one I provided over the weekend was updated with all the data regarding everyone that I don't see it.
Okay, I think I have a copy.
Madam Chairman,
Yes.
the second resolution that was part of the agenda was drafted by staff. It's part of, or it was influenced by Onslow County's resolution that they passed. So it was just out there, alternative. And,
I've got it here.
Okay, well, I do.
So we have three resolutions and then
And then I sort of took the resolution that Commissioner Smith provided over the weekend, and then some of the information from Onslow, some of what Ms. Parrish provided, and then just the mountain of reading and listening I did over the weekend to just try to incorporate something that we could pass along to the governor's office and get back to business in North Carolina. So I guess I just, entertain discussion. If you've had time to look over them, they're a little bit different. I think they're
They're a lot different.
their goal is the same.
I don't know about that.
Discussion?
Madam Chair.
Yes, sir.
Can I ask a question on the board?
Sure.
How many received a email from Jan Hill? She attached a very interesting video to it. Two doctors in California giving their professional, on-the-ground assessment of what they were seeing and some of the things that we are doing as a society and as a country are practically wrong. And I want to know how many watched that video. I watched it last night when I got back from work, and it was pretty intense. I mean, it was.
Yeah, I haven't had a chance to see it. Has anybody else had a chance to see it?
I have not.
Okay. What can you kind of summarize it for us?
Well, I wasn't sure. Well, yeah, I can. They gave the statistics of what they were dealing with. Now, both doctors are microbiologists. They've been in the field for 20, 30 years, I think, combined 40 years, the two of them. They were in their 40s. They basically stated that when the closing in of everybody reduces their immunity, everybody being closed in, secured at home, reduces your immunity. They talked about how we are exposed to all sorts of antigens or all sorts of viruses and bacteria in daily life, and that we are actually making things worse because when we do open up, we're going to get a spike in the number of cases. They were okay, I'm getting feedback.
Someone who's on the line.
Yeah, I'm getting feedback. But it was quite I mean, they went with the facts that they had, and everything pretty much correlated with the numbers that I had, prepared in the resolution, 1.4 one-thousandths of 1%, 0.01% or 1/100th of a percent. I mean, they were reflecting upon the actual numbers of cases of individuals and the morbidity rate, which was... Somebody's got their phone they're doing something with.
Yeah, they need to, you might want to suggest they mute.
Yeah, if the commissioner's on the telephone, if you can just mute your phones, because we're getting a lot of feedback here in the room and on the live stream, and just if you want to talk, just unmute your phone. That may help a little bit, please. Thank you.
But it was eye-opening, and it pretty much highlighted the fact that what we're doing is not actually helping the public health. We need to be exposed to these things to the degree they're not as fatal as we are, because they did mention the fact that there are comorbidity issues with individuals who have other health issues, and he listed a whole number of them. He talked about high blood pressure, heart conditions, all sorts of immunodeficiencies that
Right.
correlated with you getting infected with this. This is a pretty aggressive pneumonia-like infection. But the fact is that they're both emergency room doctors with microbiology background, and they work with this on a regular basis. And they were interviewed by local news agencies. I guess both of them are television stations in California. But it was very enlightening and very opening, and they were very honest. They stood on the fact that they are on the front lines. They see these people every day. And then the questions by the press was, well, you have Dr. Fauci and the others giving advice. And they basically respected the gentleman's advice, but they said that he is not on the front lines with the actual cases that they're dealing with. And I'll leave it at that. But I'm sorry that I'm the only one that watched it, because it was quite...
I saw it as well.
Oh, okay.
Okay. Discussion from those of you on the phone?
This is Ariana here. One concern I have is with the first resolution in our agenda. It therefore be it resolved, and about midway through this the paragraph, it considers the implementation of adopting the requirement of face masks, and I'm a little weary of that. I'm all for encouraging the use of face masks. I think that it's something that can absolutely be strongly encouraged, but I think we're crossing a little bit into mucky waters when it's a requirement, and so that's something that stood out to me that I can't support.
There's a lot of people that have wear masks, people that are claustrophobic, people that have trouble breathing. So you require these things, and going to give exemptions to those people, and two, are you going to supply all the people in the body if you're requiring them? Encouraged, I think, is definitely something we can do, but not requiring.
Okay.
Madam Chair, what is the date that the governor is supposed to come back and give us another report?
I'm not aware of a specific date. I just know that, the most recent deadline is May 8th.
That's the date I was looking for.
Okay.
Yeah, May.
Yes, May 8th.
I could be on board with any of these resolutions, but I would like for the date for our date and our resolution to be effective May 11th. Just my opinion. To not undermine the governor and be as quiet as political, and I think that would be better for our community, but I'll listen to the rest of the discussion.
Okay, is there, the,
Madam Chair, if I could
yes.
add?
Sure.
I mean, I know I'm getting bombarded with individuals concerned that their businesses are hurting. They're not able to care for their families, or they're worried about taking care of their employees who are let because they're closed. There's just so much pain in our community that I'm not really certain why the governor moved it to May 8th, but, I mean, he set it to May 8th. I just simply wanted to overturn,
Well, that's,
His
you know,
executive
May
order
8th is still,
121.
May 8th is still, at home order. You're just allowed to leave your house to go shopping and no groups greater than 10.
Right.
So that still, limits restaurants and, other facilities, churches, meaning. So that's gonna take even longer. That's gonna take restaurants and churches another month thereafter. But they're allowed to. A month forward.
Madam Chair, what is, from an organizational standpoint, what would be the position of the board? I mean, is the board expecting us to reopen our facilities? And when I need some direction here, or for what to tell the staff,
Right, I
because we
think,
have some issues that we need to address.
I think that's, and maybe we need to have that discussion before we finish with the resolution. But I think as a board, we need to be mindful that whatever resolution we pass, it is not just for private business, but, it also affects our staff. As some of you may have seen, we have 125 cases now. It went up 15 more today. Do you want to go ahead? Do you want to share some things first before we go further?
I just, in talking with the staff, there are several issues going on right now. Number one, with employees working at home and schools being closed, you have childcare issues. I need to give the employees a couple of weeks' notice so that they can take care of those things. A lot of, we have the summer coming up, and schools will be, closed during the summer. Some of the programs that we typically run during the summer, we had considered not running, namely out at Sandley Park, which basically becomes a mini daycare for a lot of kids out there. And also we're talking about what to do with parks and recreation programs, whether we're going to run baseball, whether we're going to allow swimming, and that kind of thing. So, if all of a sudden, it's the belief from the commissioners that we're open for business, I mean, does that mean we're going to open for business? And then how do we protect employees and the public while we're coming together? We have acquired additional PPE for the employees. I went ahead and did that after this resolution was presented last week. We're evaluating daily screening of employees, how to do that and comply with HIPAA. We have additional thermometers on order because we'll need basically 2 at each facility. And we've started an evaluation of buildings where we can create greater separation of public, and that occurred today. So we're going through every building, trying to make sure that where people enter the building, we can create separation between us and the public, and protect our employees. So those were the notes I had about this and what that expectation was Because we will,
Resolution doesn't change any of that. We're just asking Cooper to make modifications. But if he doesn't make modifications, resolution doesn't supersede his, does it?
well, I would think we would be going along with any changes that the state would make, and then we would have to make our own determination, because right now, if you were to read his executive order, running local government is an essential business. We've made the decisions on our own to close our facilities. There was nothing that said that, in his order, that said that we had to close what we closed. That was more, had to do with the number of people that could gather in one place, in the services that we deemed as essential internally. So I look at library services, senior services, veteran services. I can go down the list and say, are we going to open our doors and start running, and start allowing the public to come in our doors?
Questions or comments?
Well, Madam Chair, if
Yeah.
I can add, is there someone else? I'll
Yeah.
defer.
Go ahead.
Yeah, this is Kevin. I just want to make a comment. That's all, just a comment. Of course, I have a business, and certainly mine has suffered, even though my business is deemed essential. But of course, we haven't been able to really hold any classes for any kind of firearms training because of gatherings of no more than 10. Well, our concealed carry classes, they're rather large, but the irony in all this is, people are still going to do what they want to do, and you just go down to Lowe's Hardware if you want to see that. Every day you go down there, it's like grand opening. They only got probably like 43,000 people in that place. Obviously that's figuratively speaking, but Lowe's has flourished during this, and I know I've been in there before. I try to maintain my social distance, but I can sure tell you they're not exercising that down there at Lowe's Hardware. And I wouldn't feel any different, quite frankly. And I know that none of this, my comments are going to change anything. We're going to go along with the governor, but I don't see any different me going to sit down in a restaurant somewhere to eat as opposed to being in Lowe's Hardware. There's people all around. And like I said, you don't necessarily have to touch anybody. My goodness, we're all wearing masks, and that's fine, but I've noticed a lot of the stores now, they're wearing gloves. One of the dirtiest things you can touch is money or a gas pump. And I know we have to take responsibility for ourselves and our safety, but it's just, I guess it's just frustrating, because I really feel for the restaurant businesses that, the restricting, Chick-fil-A, they're geared for takeout, probably as much as they are dine-in, and I eat there a lot, and they're doing just fine, but you take the dine-in right down the street from me, I feel really sorry for them. They're hurting, and I don't know what the real answer is, but it's just a comment, that's all.
No, thank you, Kevin. Kurt?
Yeah, if I could ask, and one of the things those doctors revealed was the fact that clustering everybody indoors is not conducive to good health. And they were mentioning getting outside with your children, and they need to be out in the dirt, and they need to be getting involved in, those things that kids are supposed to do to build up their immunity. When we seclude them and take them out of the population, we've accelerated the fact that they could become less immune to various things that are in our environment. But I did hear something I'm trying to think if it was on this morning or yesterday on UNC. They were talking about summer schools programs are still up in the air. They didn't say they were closed, because the governor had made the determination to close schools to the end of the year, but summer school is still up there. So that's something to think about. As far as parks and recs, there's nothing better than getting the kids outside, in my honest opinion. But that being said, Madam Chair, I'd like to move to propose a resolution requesting North Carolina Governor Roy Cooper allow Executive Order 121 to expire and reopen North Carolina for business, education, and social activity. And I'm willing to read my resolution.
Okay, go ahead, Commissioner Smith, go ahead and read
Okay.
it, and then we'll have a discussion.
I already gave you the title. Whereas in December 2019, a novel new coronavirus was first detected in Wuhan, Hubei province in the People's Republic of China, causing outbreaks of the coronavirus disease, COVID-19, that is spread globally. And whereas the Secretary of Health and Human Services declared a public health emergency on January 31st, 2020, under Section 319 of the Public Health Service Act of 42 U.S. Code 247D in response to COVID-19 pandemic. And whereas on March 13th, 2020, President Donald J. Trump declared a national emergency in response to the COVID-19 pandemic. And whereas on March 17th, 2020, North Carolina Governor Roy Cooper issued an executive order ending seated dining at restaurants and private clubs. And whereas North Carolina Governor Roy Cooper ordered people in the state of North Carolina to stay at home for 30 days until April 29th of 2020, in another step to slow the spread of COVID-19 virus. His executive order number 121 took effect Monday, March 30th at 5 p.m. and reduced the size of gatherings to no more than 10 people. And whereas the order provides for essential businesses to continue to operate while prioritizing social distancing measures, despite not being approved by the North Carolina Council of State, the order is presumed to have the force of law in all 100 counties. And whereas on April 15th, 2020, Governor Cooper indicated his executive order would remain in place until the federal government provides North Carolina with an unspecified amount of personal protective equipment and expanded testing capacity, and that it would remain in place until the state secures business partners to implement contact tracing. And whereas on April 16th, 2020, the President of the United States outlined and published a three-phased framework for reopening states and regions for business and social activity, once they are 14 days past their peak in reported new cases. And whereas, according to the 2016 statistics, North Carolina has 843,724 small businesses, creating 97.9% of North Carolina's business activity, employing 1.8 million citizens across this great state, comprising of 46% of employees. And whereas the North Carolina Chamber of Commerce has assessed the governor's executive order and projects the loss of up to half of our state's small businesses, including a large number of private medical and dental practices, should mandated closures be sustained for months. And whereas from March 16th to April 9th, 2020, a total of 509,693 North Carolinians filed initial unemployment claims attributed to the government shutdown. And whereas this is a correlated rise in unemployment, there is a correlated rise in unemployment, depression, and suicide as many citizens spiral into despair from lack of income and meaningful employment. And whereas the United States population is approximately 330 million, as of April 17, 2020, there are approximately 680,600 COVID-19 cases in the United States, which means a 0.21% of the contiguous 48 United States population has been infected. That's 2.1%. There have been approximately 34,725 deaths, with a 94.9% survival rate or a 5.1% death rate, making the total mortality rate 0.01%, or 1/100th of 1%. And whereas North Carolina has experienced approximately 5,610 cases, resulting in 148 deaths with a population of 10.4 million, meaning, I don't believe these numbers are super accurate. I know I changed these numbers this weekend, so just letting you know that. But the bottom line is that the survival rate is 97.4%. The death rate is 2.6%. The mortality rate is 0.0014%, or 1.41 thousandths of 1%. And whereas approximately 7,452 people die each day in the United States, according to the March 20, 2020 UN World Population Prospects, and approximately 186 people die from a variety of causes each day in North Carolina. Yeah, this is the old one. But it still stands as far as the numbers. Lee County has yet to suffer any fatalities from COVID-19, while businesses and employees continue to suffer irreparable economic damage. And whereas the CDC indicates 20 states are already planning to reopen beginning on or before May 1st, 2020, including our neighboring states of Tennessee, South Carolina, and Georgia, which has a higher per capita incident rate of disease and death from COVID-19 than North Carolina. Now therefore it be resolved by the Lee County Board of Commissioners that the North Carolina Governor should allow Executive Order 121 to expire on schedule April 29th, 2020, and immediately grant county governments the authority to plan and execute a phased reopening for business, education, and social activities beginning April 30th, compliant with the Executive Order of the President of the United States, and then ask the county clerk direct to forward a copy of this resolution to Governor Roy Cooper. I apologize. The one that I had the April 15th, April 17th data. I did update it, but the only difference was on my updated resolution, just the numbers changed. And they're essentially the same percentages.
Right. Okay. Discussion on the phone? Questions, comments?
Yes. It's interesting when you don't see folks and you listen. And the manager raised the issue of what are we going to do. It really sounds as though we are moving too quickly. We have no plan in place to react to. I ask the county attorney to contact the association to find out how many resolutions had been forwarded to the governor, and I don't know if the numbers are accurate or not. But what I think I understood her to say, when she's right there, was there were 3 letters and 1 resolution, the one that was mentioned from Onslow. And it seems to me that a letter of recommendation would be just as simple and not nearly as political as it sounds right now. It sounds like we're playing politics over people. And I frankly don't think we ought to be taking these steps until we have a plan and a good plan in place.
Thank you, Commissioner Reeves. Anyone else on the phone? To your point, Commissioner Reeves, I think that counties are doing both things. They're sending letters and creating resolutions. I think, just sort of the alternate one that I proposed was a little bit more addressing my concerns about who's going to pay for the things that we haven't budgeted for, that we're going to be looking for or anticipating that we're going to have to provide in the next few months, as well as, trying to get some additional help with the National Guard. But I mean, things like that, yes, can be put in a letter. I also have concerns about the resolution because, and I'm kind of looking at the attorney right now, if the governor has 135 as the executive order, does that negate the 120?
121.
121, I'm sorry.
I'm sorry, you have to refresh.
Well,
Go ahead.
I mean, this resolution is focused on 121. Does it preempt 135?
I would maybe update the bottom to say, and now therefore for the May 8th date, because he's already extended since he's already extended the stay-at-home order, I would probably,
That was the,
because the last executive order extended his to May
that was the answer I got, was that
Supersede.
it's, since he's moved on to Executive Order 135 and changed the date, then that, the 121 has passed.
The only unfortunate thing is that's another 2 weeks that people are not working, businesses are not open, and we're having more people suffering. I just need to
Understood.
consider that.
8th. I guess you could send it on this one, but I just don't know if he's already extended. The one that's in place right now
Right.
extends to May 8th.
See, that was because we delayed from last week to this week, and then in the
Right.
interim, the governor made his ruling, so.
Right. Okay, any more comments or questions? Okay, there's a motion on the floor to approve the resolution requesting North Carolina Governor Roy Cooper allow Executive Order 121 to expire. Again,
Madam Chair, I can move to amend that,
okay,
put in 135.
okay. So it would be Executive Order 135 to expire and reopen North Carolina for business. And then, I'm sorry, Commissioner Smith, but like the therefore paragraph.
Yeah, it would be.
It would be Executive Order 135 to expire on schedule May 8th. Okay, is everybody clear on that change for the resolution?
No. Will there be, if it is, will we then have our own stay-in-place ordinance or, I beg your pardon?
The purpose of the resolution is to let the governor know that people are hurting.
Yeah.
And I know that the governor has the executive authority, and our resolution, we could just, tear it up and throw it in the trash like somebody we watched a few months ago.
Well, again, people over politics. We've got the motion on the floor. We need to vote on that.
I've asked a question. Did you hear the question?
I did. I don't know how I understand.
To suggest that the governor does not know the people are hurting is really an insult. Now, this should have been given far more thought by the board before it hit the table. This is nothing more than a political ploy again. Stop playing games, folks. This is a serious matter, or it is to me. And I can wait on the leadership that we have in place to hopefully find the right things to do. Not trying to get one up on the governor. That's all this is about. Call the question.
Okay, all those in favor of the resolution say aye.
Aye?
Oh, I'm sorry.
Sorry,
I'm
do
so
roll
sorry.
call.
I've got to do the poll. I'm sorry, guys. Old habits. Okay, Commissioner Reeves?
No.
Okay. Commissioner Del Palazzo?
Yes.
Commissioner Dodson?
Yes.
Commissioner Sharp?
Yes.
Commissioner Connect?
Yes.
Commissioner Smith?
Yes, Madam Chair.
And record me as no, please. Okay, we'll pass that along as amended. Now, so we, as Commissioner Reeves stated, we need to have a discussion about our staff and moving forward. I think, again, as he said, this is deeply serious. And I don't think that the vast amount of our citizens really kind of understand the scope of this thing and the fact that it's going to be with us for a long time. We do need to get back to work. We do need to get back to some type of semblance of normalcy. But I think that's going to be very different than what a lot of our citizens imagine right now. And that's where local leadership is so important. And I would just ask for our board, if we can't put politics in the back seat for a pandemic, shame on us. So that's my 2 cents worth on that. So, John, do you have any other things, I've got a few things on my list, and I'm sure everybody else does too, but just to make sure we don't forget anything that you or staff has put together.
No, ma'am. All I needed, I already pretty much talked about the notes I had on here, and we've already talked about the cases. As I said, 15 new ones today. One of the big issues that the health department is having is doing the tracing, and they are starting to do screening of their employees as well. So DSS is doing that, but Heath was able to get help from the Board of Education nurses, and they are sending at least one nurse a day over here to help Heath with and his folks with the tracing. So with the staff we have, doing 15 tracings a day is difficult, and plus we're still monitoring 105 individuals on an ongoing basis. Only 20 of the 125 have resumed normal duties, so the health department is very busy. But I commented pretty much on everything else that we were trying to do to get ready to reopen.
Okay, thank you. So the one thing that I think we need to remember in all of this is it's like I was trying to explain to somebody the other day. If you can imagine the biggest aircraft carrier that we have, and we're trying to turn 180 degrees on a dime with that aircraft carrier, with what we're dealing with. It takes a long time, and for those of you that have followed our board, and you know that's one of my pet peeves is government takes so long to do things, and there's a lot of competing agencies and that type of thing that makes things difficult. So I'm amazed at sometimes about some of the things that are happening, and then I'm frustrated at other times about how some things are not happening. Again, this hasn't happened in our country for over 100 years, so I guess in a way it's a good thing that we don't have a lot of practice with it, but we've got to figure this out, and quickly. The guidance, and I mean, I understand everybody's frustration and heartbreak, despair, with everything going on. And I don't think this board takes that lightly at all. I think we all are shouldering responsibility for how our citizens are feeling. But at the same time, as everybody goes back to work, we need to make sure, everybody's heard by now the flattening the curve, and we need to make sure that when people do get sick, that our healthcare system can handle it. When we I know everybody's watched the news and seen over the last few weeks, the hospitals in some of the larger cities that have been overwhelmed, and how much of a nightmare that's become for people. So, we're getting very close, but again, listening to the governor and also listening to Senator Berger. You know, I was happy to see the bipartisanship with the two of those gentlemen, that Senator Berger is supportive of what the governor's doing right now. And it's following the president and the federal government's guidelines. We still do have a problem with the testing and the tracing. Hopefully, in a week or two, based on what I think I'm kind of looking at John and Jennifer Whitney. I think based on what Dr. Cohen said during the press conference this afternoon, hopefully they'll have some more equipment stuff for the next couple of weeks, and they're hiring people to do tracing. Are we going to get, I mean, how is that working? I know they've hired 200 and they're hiring another 250 or vice versa, but don't know. So I'm just kind of looking for some guidance from the board, because I know Dr. Crumpton and our department heads are looking for guidance on how you feel about our staff and the timelines. I do know, just to start, I'm trying to get some discussion, folks. I do know, you know, in a lot of the reading and listening that I've been doing, one recommendation is for the foreseeable future, and I've talked to Dr. Crumpton about this a little bit, you know, to try to keep as many of your folks working from home as possible. You know, I mean, they're still working, they're still doing their job, but doing it remotely, especially with the school situation as it is now. And another idea was to have staggered shifts, you know, whether it's some come in the morning, some come in the afternoon, or some work, you know, in the office Monday, Wednesday, Friday, some work Tuesday, Thursday. You know, just so you're not having so many people in the office at one time. And that's kind of getting in the weeds, and I sort of feel like that's something that Dr. Crumpton and the department heads need to figure out. But I know they need some direction from the board.
If I had my P's and Q's, we would order the schools to be open and send the kids back, but that doesn't work anymore.
Yeah, that decision.
Excuse me, Madam Chair.
Yes, sir.
We're not trying to work this out tonight, are we?
Well, I think it's just something that just for some discussion. I mean, no, I mean, we've got May 8th is the date that the governor has set up. And that coincides. I'm sorry, go ahead.
No, I was just saying, I acknowledge that's correct.
But you know, I think that's something. I mean, if you don't want to discuss it tonight, we can wait and discuss it next Monday night. But again, you know, like Dr. Crumpton said, you know, when you're talking about childcare and that type of thing with the schools being out, you know, we need to give staff as much time as we can so that they can get their lives in order to come back to the office. Just putting that out there.
Yeah, I agree wholeheartedly. You just can't flip the switch on this deal.
Right.
All right.
Any other commissioners want to weigh in?
Well, you know what the, which staff are okay with certain recommendations and how many staff are okay with other recommendations? You understand what I'm saying? So how many are okay with, hey, I don't mind coming back to the office compared to those that aren't?
That's for you.
Yeah, I mean, we've got a complicated workforce, as you're talking about outdoor rec, you're talking about library, you're talking about the enrichment center, you've got all these different facets. Nobody said we were gonna turn the switch on, everybody's open and we're open for business, but the thing is that, again, that's why we pay the good doctor good money to make sure he takes care of it. No,
My question was based on what the expectations would be by the commissioners.
there's no expectation that we're gonna turn the switch on, everything's gonna work, in my opinion.
Okay.
I mean, it's gonna be phased in, and it's still federal, state, and then we go from there. But it is something we've gotta look at, we understand that.
I mean, I agree with Commissioner Smith, you know, we definitely don't need to just call all the employees in Wednesday and say, okay, everybody come back to work next Monday, you know. I mean, is everybody in agreement with that we need to sort of phase it in and leave it up to Dr. Crumpton and the department heads to work it out for the foreseeable future?
Yes.
Yes, I agree.
We need a motion on that?
No,
I don't think we do.
you don't need a motion.
Okay, so, one of the things that I wanted to talk to the board about is, again, you know, in talking to other commissioners and all these Zoom meetings and teleconferences and stuff that I've been doing for the last few weeks, one of the things that's sort of becoming very clear is, you know, we do need kind of, you know, I'm reluctant to use the word task force because I just don't like that phrase. I've heard it so much, but I just kind of want to get the board's opinion. We you know, we have this group of individuals, you know, myself and Dr. Crumpton and the Mayor Mann and the city manager and Mayor Andrews and the town manager, along with the Saga chair and CEO, the superintendent and the chair of the school board and the president of the college and the chair of the college board of trustees. The 12 of us, you know, get together fairly often. We're kind of behind now with all this going on, but perhaps, you know, convening that group and then maybe bringing in a representative from the United Way and the sheriff, you know, a couple of other people, just to start, you know, looking at what the plan will be based on the guidance that we're getting from the state and the federal government over the next few months. Does anybody have a problem with that or have a suggestion for somebody that would be in that group?
Did you
I
mention
agree with
law?
that. Go ahead, Commissioner Reese.
I just want to know, did you include law enforcement?
Yes, I said the sheriff.
All right. And the chief of police?
Yes, yes.
All right. Hospital CEO?
Okay. Anybody else have a suggestion?
Do we have Broadway Town on?
State representatives?
The state representatives, is that what you said?
Yes.
Okay, thank you. Okay. Anything else with regard to that? Okay. All right. Anybody have any other ideas or concerns that, I know you guys are all getting emails and phone calls like I am on things that we could do?
Madam Chair, I would just like to say that I trust staff and I trust Dr. Crumpton to, they're on the front lines, and I would just ask at our next meeting, they bring something, back to us that they think we can implement.
Okay. We also need to think about too, I know Commissioner Reeves, you asked for us to look at the Durham policy on the face mask, and I hear what Commissioner Del Palazzo and Connect are saying about the face mask too. That's one of the things, that a lot of people have asked me about. They're not necessarily opposed to them, but, they have some issues with claustrophobia or other things that make it difficult for them to use a face mask. I'm not sure about, making somebody wear one. But another thing, and this is something too, that as we gear up and we open back up, is just the production lines of things. I've tried to order face masks for weeks, and I finally got a couple in today, actually. But they are few and far between, and I know some people are making them. So I'd encourage people that are making them to, tell your church so they can put it out through their church emails or all calls or whatever, or Facebook or something, because I have people that say I would wear one if I had one, but they don't know how to get one. And another thing we talk about is using hand sanitizer and that kind of thing. You cannot find it. You absolutely cannot find it. So it's just the components that we need to sort of keep people as healthy as we possibly can as we kind of move in, I guess, from phase 1 into phase 2 as things start to open back up. So it's time for everybody to think outside of the box. And I've heard some interesting ideas of things. Again, just think about it. Maybe we do need to start as a board to write some letters, but I think it maybe started on Facebook. But one gentleman had an idea that, for our folks that are out of work, yes, they got $1,200 and then, money for their children. But we all know if you've got a house payment, a car payment, you're paying for college, maybe you've got groceries and health insurance and life insurance and on, the $1,200 goes away in a hurry. So his suggestion was that, and this would have to be done on a federal level, would be that, all of your payments, whether it's car or mortgage, whatever, that they're just paused, and until we kind of come out of this. And not that you are forgiven from doing that, but if you have 2 years and 2 months left on your car payment and you don't have a job for 5 months, then it becomes 2 years and 7 months. When you when you get back to work and you put it on the back end, because I know, and it was a great point, for those that remember what 2009 and 10 were like. That's what hurt so many people was, when the economy started coming back out of it, they had lost their home, they had lost their car. It just made things worse. So just consider that idea as maybe something, as a board, if enough people start asking for it, and especially from an official standpoint, maybe something will happen, because that's an idea I've heard several times over the last few days. So evidently it's kind of making its rounds in social media, but it's a simple thing, and I hadn't really thought about it that way before. Another idea that was shared with me was, they're putting trillions of dollars out now in all these bills passed by Congress to help people. And there's the issue of the payroll payment plan that's out there, and I understand the second wave started today. It crashed, the site crashed again. So it's just very difficult for the people in need to even make contact so that they can get the help that they need. That's way above my pay grade, and I don't know the answer to that. This is a big technology problem for sure. But one of the things that was shared with me was, when you're talking about billions of dollars, if you think about it, there's 52.9 million people that work in small business. If you would give the small business $10,000 per employee, then that would be equitable to the business. The small businesses that have 3 people would get $30,000, and then the larger businesses $400,000. But if you do that, you're talking about $52,900,000,000. That's still way less than $1 trillion. And for small businesses, if they would get $10,000 per employee, then that would help them offset some of the loss that they've had. It would be a lot more fair and equitable. And then maybe not only could they offset their losses, but it would give them some money to buy personal protection equipment and put shields up and whatever they need to do to make their business more accessible. And like this one person said, if they could get something like that, then they could put outdoor seating at their restaurant so that they could, have more customers come in. So it's those sort of, crazy ideas, but once you start talking about it and how you could apply it to the problem, it makes sense. So, just for some consideration, and maybe, if somebody would want to make a motion or something next week when we meet, and if you come up with some other things, I think one of the things I'm getting frustrated about is it seems like everybody's talking about the same thing all the time, but I don't see a whole lot of action to get us back to where we need to be. We need testing, we need tracing, we need protective equipment, we need sanitizer, we need disinfectants.
Toilet paper.
Toilet paper, yes, oh my gosh. We need these things so that we can try to keep as many people healthy as we possibly can, understanding that, people will get sick when we go back to what it kind of looked like before. But we need all those things, and it just seems like it is taking an awful long time for us to get them. I know I applaud Dr. Crumpton and our Heath Kane, our health director, and Shane Seagroves, our emergency management director. They're going out and finding the stuff, but yet, we still need things for the people on the front lines. Hopefully, after what Director Sprayberry said today, I think he's expecting a big shipment sometime this week. So we should get some things out of that shipment. But anything else from the commissioners on the phone?
Yeah, I was just going to mention, I just asked the board to look at the Durham. I didn't ask you to adopt it. But as far as masks goes, I know that Cumberland County was using their 3D printer to create or develop masks. I know that a school over in Winston-Salem was making shields for those who couldn't wear masks.
Right.
So there's some options out there. I understand that there are some folks who can't, claustrophobia or whatever the case may be. I understand that.
Right, and I think Mertec, one of our homegrown companies, is making the shields as well, which is pretty cool.
Making something
Yep.
and masks.
Right. Anything else for the commissioners on the phone?
Yeah, I'll move to adjourn.
Commissioner Smith, did you have anything?
No, ma'am.
Okay, there's a motion to adjourn. So all those in favor, I guess, let's just say, all those in favor say aye.
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 All right.
Okay, all those opposed? Okay, we're adjourned, and we will see everyone next Monday. Thank you.
Muted.